Behind every dermatology visit is a team you may not see. There's a big difference between shadowing a doctor and actually being part of the care team. At Charlotte Skin and Laser, our medical assistant program is designed for recent graduates pursuing careers in medicine. It's not just a job, it's a structured, hands-on clinical experience where MAs assist procedures, work directly with patients, and learn what practicing medicine really feels like from the inside. Today, we're talking about what that experience is actually like, the learning curve, the growth, and how it shapes the next generation of providers.
Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Roston, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started.
Hi, I'm Dr. McLean, and I am thrilled today to be with two of our wonderful medical assistants. So today we have Samantha and Mansi, and I'd love it if you guys could just introduce yourselves. So Samantha, you want to go first?
Yeah. Hi, my name is Samantha. I'm a medical assistant here at Charlotte Skin and Laser. I've been here for about 6 months. I pursued a degree in psychology at North Carolina State University, graduated in May, and I'm now looking to be a PA and getting some hands-on experience here.
And hi, I'm Mansi. I've been a medical assistant here for about 8 months. I graduated from Clemson University with a Bachelor's of Science degree in biology. I also hope to go to PA school, so I'm also here for just hands-on experience.
Great. So Mansi, how'd you find out about Charlotte Skin and Laser?
Funny story, I was in my last semester of senior year, and I was like, Mansi, like, you really need to start looking into things that you're interested in. And
You couldn't just stay in college forever?
No, I know. I really wish I could, but I couldn't. But I went on Indeed. I knew I really didn't want to stay in Columbia. That's where I'm from. So I was looking at just places around. I was looking anywhere from Charleston to Charlotte. And so I found Charlotte Skin and Laser. A lot of the medical assistant programs required certifications, but something about this program that was really interesting was that it was hands-on in office. And so training was in office. And I think that's something that I learn a lot from. So I applied. I got an interview. I actually shadowed Dr. McLean, which was super awesome. Just seeing her interact with patients was something that was super cool to do. And so I applied, I got an interview, and then they were like, Mansi, we would love to have you here. And I started in June.
It was the ruffle scrubs that did it.
It was the ruffle scrubs.
Yeah, Mansi showed up in some extra cute scrubs with a big smile and a good attitude. So we knew it was a fit right away. So I'm so glad you found us on the internet.
Glad I'm here.
Yeah.
It's awesome.
And what about you, Samantha? How'd you find out about us?
So my mom has actually been a patient of Charlotte Skin and Laser for quite a long time. She does see Dr. McLean, and she actually told me about the medical assistant program here. She knew my aspirations to go to PA school and be a PA, and had talked to actually some of the medical assistants during her visits about the program and how they got hired and what that process was like, including the day-to-day skills that is required for this job. So I did go ahead and reach out to our HR manager, told her that I was very interested, told her a little bit about me, and got set up for an interview. After that, I also came in, shadowed Dr. McLean here, had a really great experience and knew that it would be the perfect fit, and was hired shortly after that.
Yeah, well, we're so happy to have both of you. We've been working really hard as a practice to bring in really positive, hardworking, smart, ambitious team members, and I think both of you exemplifies that. So thank you for you being part of the team. So just question, I mean, I think that this is not an easy job. We kind of throw you guys in head first. So can you just talk about what your first few days were like, and, did you ever think about quitting?
No, I'm just kidding. I never did. But coming from a background, I did work in family medicine before I was a scribe. I think just working in dermatology is something that's so different. It's very hands-on, and working as a scribe, I was always behind the computer. So coming in here, just having no knowledge of dermatology was really eye-opening, because you guys really do want us to learn and want us to kind of just be thrown in there and see what we can do and see what we can learn from. And it's a continuous learning environment, which is something that I love to see and love to be a part of. So that's something that when I came in, I was really anticipating more of observing my first week, but by the third day I was taking back patients, and it was, you get to know patients on a different level, and when they come back again, they know you, and it's something that's like really reassuring.
And what about you, Samantha? What were your first few days like?
You definitely get thrown in from the start. I did start seeing patients about day 3 as well. But honestly, the hands-on experience, I think, is how you learn best.
Yes.
So being thrown into it, I think, in this scenario is a really positive situation. And I learned a lot really quickly, which is one of the things I love about dermatology is that it is so hands-on. And that during that hands-on experience, you're learning really quickly about different types of procedures, different types of diagnosis and conditions. And you're also learning each provider and how their preferences and how they're different, which I think will set us up really great for PA school 100%. And how this is a really collaborative environment being in the medical field, and how we're already being exposed to that here. I think it's really great.
And I'm sure both of you, I think you had experience in different clinical settings. You've mentioned how dermatology is different. You mentioned hands-on procedures, but how else has dermatology maybe surprised you or been different than your other clinical environments?
Yeah. I feel like in family medicine, you're kind of seeing a routine, same thing, hypertension, diabetes, things like that. But I feel like our patients that come into the door are coming in with so many different problems and things that they want treated. Sure. And I think we have so many different opportunities to treat them. And having providers that constantly want to learn and constantly want to feed off of each other is something that Samantha and I feel like exhibit like a lot throughout our day-to-day basis. Just seeing you guys collaborate is something that is super rewarding to see just on the sidelines as well.
Yeah, so I'm glad that that's the impression, because we certainly, we all miss the mark sometimes, and we all have our little grouchy days, but I think on the whole, one thing I love about working here is collaborating with Dr. Roston. Sometimes I'll go ask her, say I've got this patient, we've cleared up their medical condition, but now they have this cosmetic issue left behind, and I can go to her for advice, or hey, Ellie, I know you had a patient with something similar last week. How did you treat it? Or, sometimes they'll come to me as their supervising physician, and, they'll need a little bit of extra help. But I will say, I think one of the things that's great about you guys is that, yes, there's so much variety in what we do, but we also see a lot of things that are pretty repetitive. And I think that you catch on to things pretty quickly. So sometimes I'll have Mansi come to me and she'll be like, this patient's here for a full body skin exam. They're fire. And I already know what that means. In Mansi speak, that means probably they're not really worried about anything. They don't have a history of skin cancer, and nobody in their family has melanoma. So we kind of learn each other that way. Or, sometimes Samantha might come to me and be like, this patient's here for a spot on the cheek. I'm not sure really what it is. I have a feeling you might want to biopsy it. And a lot of times after just a few weeks working with us, I think you can kind of get that sense, and having your brain switched on and really buying into that patient encounter and not just being a scribe is helpful for the patient. It makes their visit more efficient, and it's also really wonderful for us because it shows us that you're learning, you're engaged, and it makes the day go by much smoother. So thank you.
It's also just really fun.
It is.
Just you being like, Mansi, what is this? What do you think it is? And how would you kind of treat it? It kind of puts us in that space where we're being prepared for PA school and what we're going to see. So it's just fun seeing that kind of side of it as well.
Yeah. And I'll say sometimes I get stuck in a rut and I kind of recommend the same thing sometimes. And, Samantha or Mansi or one of our other MAs will be like, oh, well, what about this? Like, for example, Amelia, she's one of our new PAs. The other day, she was in the room with me and a patient, and she reminded me about sulfa wash. For some reason, I always forget about sulfa wash, and it can be really, really helpful in certain types of acne. So it really is a collaboration. I don't know everything. One of the things about medicine is that I'm constantly learning too. Dermatology is such an exciting field. We keep getting newer, better medicines for chronic conditions. It's super rewarding. And for us to sit down with reps over lunch and all learn together is just really fun. And I love having pre-professional students or employees, but, pre-professional, ambitious young people to collaborate with, honestly. I really do view it as a team. I'm not your boss. I'm not here to tell you what to do. I'm here to work together so we can provide the best care for the patient. So I think another thing that we lean on you guys for a lot is counseling the patients. So we're busy here. If you've ever been in our clinic, our parking lot is often full. We're working on our processes to make them constantly more efficient, but sometimes we have a line at check in, check out. I mean, we are busy. And one of the things that allows us to provide really high quality care is that we lean on our medical assistants to, I say, close the deal, close the loop, wrap things up. So I will try to answer questions in the room. I don't want to rush myself. That's not the kind of medicine I want to provide. But, sometimes people need a little repetition. That's normal. So after I say it once, sometimes I'll be like, well, I'm going to step out, but Mansi can review. Mansi's going to make sure you have what you need. Samantha's going to review all the details about the pharmacies because sometimes it involves multiple pharmacies. And frankly, they know a lot of the details on the back end that I don't. So tell us about that. Was that a scary thing to kind of be thrown in to just to, be expected to counsel the patients?
Yeah, for sure. I do think this was a great situation on how you learn really quickly in those scenarios and why it's really important to be an active learner and an active listener when you're working in medicine, because when you're training, you do get the experience of listening to this counseling done by either the provider or the medical assistant that you're with, and then you're kind of on your own. And when you are, we do have really helpful tools behind the scenes for us to learn this and learn the counseling that we can practice. But within the room, there's so many closing the loops, as we say, that has to be done. And as a medical assistant, I'm happy to assist and do this for the provider. And what that looks like is if we do a biopsy, making sure they know the care instructions, making sure they know they have to apply some Aquaphor and a Vaseline, making sure that they are instructed on how they can access those results when they do come in. And if we're sending in medications, how they can pick that up from the pharmacy if they have any concerns, making sure that they're all addressed once they leave this clinic.
I totally agree. I think that it's also just a visible thing that you can see patients, just kind of a sigh of relief when you are explaining, this is how you're supposed to do this is how you're going to get biopsy results. And even if we're going over biopsy results in the actual room, you can see this is not something that you need to be worried about. And we kind of give them that reassurance to be like, this is okay. We're here to understand you and we want to be present. And I feel like that's just a rewarding feeling, especially seeing when they walk in through the door and they're walking out with a smile on their face.
Yeah. And truly, y'all are such a big part of that. We can't do it without you. I mean, I think my schedule would probably have to be half as full if I didn't have such wonderful assistants. And I've worked in other places where it was, and, that was true. So I truly appreciate all the work that y'all do every day with our patients. And then what are some things that y'all do that aren't necessarily patient facing? I think behind the scenes, day of the life of an MA. I mean, walk us through the morning. So I know some people, we make a schedule, right, for the MAs each week. And somebody's always opening, somebody's always closing. We have something called triage. Can y'all just tell our listeners, what is that? Is that something you enjoy? Is it something that you don't enjoy? Is it harder to learn? I'd love to know how you think about that.
Yeah, I feel like we have a schedule that gets sent out every week. Each of us we do collaborate a lot on opening and closing shifts. That's something that everyone takes pull on their part. Yesterday I was working on triage. So triage basically is working behind the scenes, just answering patient questions using our podium, or just covering people's medications using Cover My Meds, working with insurance companies, calling biopsy results back. I think that's a crucial part of our job as well, because there's a lot of insurances that don't cover medications, and we also want our patients to be able to get the medication that they need. I think it's super important to just advocate for our patients in that way, and I think that's also another rewarding feeling when you get that approval or that from Cover My Meds. It's like, oh my gosh, I did this. Like, I actually did that. Yeah. So that's something that triage works on a lot behind the scenes. We also do things like PDT appointments, which just helps our other MAs out just with flow of the clinic as well. Pulling them back, putting them under the light, and just having just that balance. But we're always collaborating with each other, always helping each other out, which is super important. And I think that's super awesome. We have a really good team.
Did you know what PDT meant a year ago?
No clue.
Yeah, I don't think most people know what that is. So PDT stands for photodynamic therapy, and that's a procedure that we often do in the office, a lot of times either for precancerous sun damage or more minor skin cancers. We also do it sometimes for acne. So that's a procedure that you guys are absolutely crucial for. You're helping prep our patients. You're explaining what to expect. I mean, that's another time where we really lean on you guys. So thank you for that. And thank you also for manning the phones, manning our chats and our portals. I think that is a really integral part of patient care. So Samantha, can you walk us through what is an opening shift? What does that mean? What do you do?
Yeah, of course. There's a couple components to an opening shift. So usually we get in for the day and we head back to one of our back rooms where we keep our little cryotherapy cans. This contains little bits of liquid nitrogen that we might use in the office for some procedures. And so we go ahead, fill this up with the liquid nitrogen and make sure that every single room has this for the provider when they would need it. And then when we're doing this, we also are cleaning tools from the previous day and packing them up through a sterile process called an autoclave. Which will sterilize these tools and clean them and make sure that they're ready for the next time we need them. And then another part of opening shift is also just making sure that all the rooms are ready, all the tables are stocked, and that we have everything that we need for the day and anticipating what might go on and what each room needs.
Certainly. And then what about closing? What do y'all do at the end of the day?
Yeah, so for closing, it's a little bit different, but a very similar process. We'll go ahead and clean those rooms down with a sterilization wipe, make sure that everything is good. We do document that we clean these rooms just so that everybody knows that these are clean rooms and that we dump the liquid nitrogen out of the cryotherapy cans. And then we also just go ahead and process what we call some biopsies.
Yeah. That's a process near and dear to my heart.
Process.
Yes. My biggest fear, or, one of them within the practice of dermatology is losing a biopsy specimen. That is bad news bears. So we try to have a really thorough, error-proof process to make sure we always have our biopsies ship shape and we don't lose anything. So that's a big part of what you do. So double check, 2 sets of eyes at least on everything, right?
Yes.
Yeah. Cool. Well, thank you very much for all the work on that.
Yeah.
Yes. Both of you have mentioned hands-on. So you kind of talked about some things that maybe aren't hands-on. What are some things that you get to do with your hands besides just typing in the computer?
Yeah. For a lot of full body exams, we do have a lot of patients that come back for who have history of skin cancer.
Sure.
And so we're obviously thorough with a lot of our patients, but for patients who just have a long-standing history of skin cancer, we're extra thorough in that way. Biopsies are something that we do a lot in the clinic. Being a medical assistant, we're actually able to actually numb the patient with the consent of the patient, of course, but doing that is awesome. We're actually stepping our role into that.
Yeah. Can I tell y'all a secret? I'm kind of embarrassed to admit this, but I had never injected lidocaine in a patient until dermatology residency. Okay?
Oh my God.
All right. So all through med school, all through intern year, that's 5 years of medical training.
Yeah.
I didn't do lidocaine for my own biopsies until I was a dermatology resident. So the fact that you guys are getting to even handle a syringe and actually inject something into a patient is great experience for you guys.
Yes.
It really is. So, I mean, my journey was a little different. I didn't work in a healthcare environment before medical school. So it's a little different, but I think the point of doing all these clinical hours before you go to PA is to get that kind of experience. And I think we're proud to be able to provide that for you because I think some of the bigger systems have a lot of rules over, what you can do. We're all in compliance here, but we don't necessarily require that you have a CMA license. We do supervised on-the-job training here, and you're allowed to do some things within your scope of practice, such as lidocaine injections. What else do you get to do that's hands-on, Samantha?
Yeah.
I know recently you helped me with a surgery, and I didn't even realize it was your first time.
Yes, so recently I did assist Dr. McLean in a surgery. Usually these were excising some skin cancers, sometimes some cysts, and this just involves making sure that the tray is all set up. We're practicing sterile technique by doing some sterile gloves, making sure that everything is just what the provider needs. You anticipate their needs. Are we going to need stuff for what we call a body pack for a body surgery? If it's something on the face, are we going to need a face pack? If it's a cyst, are we going to need something that we call a punch pack? And just anticipating and setting up what kind of tools we're going to need for this procedure.
Yeah.
And then we're also just handing the provider the tools during this procedure and helping make sure and assist that everything goes smoothly.
Yeah, absolutely crucial to that experience. And then you're also doing a lot of the wound care and counseling at the end of that visit. And then when they come back a week or two later, RMAs are doing the suture removals and providing wound care if needed. We're always here as providers in case there's an issue, but a lot of the times if things are healing up just fine, our MAs completely do the suture removal visit and we don't see them back unless there's, a new skin cancer down the line, unfortunately. So I think that one of the things that's important to me is really getting to know our patients. I sometimes say kind of crudely that you're more than just a sack of skin, like what's going on the inside. And I can think of many patients that stick with me, but in your time here, have y'all had any patient interactions that maybe struck you and maybe their emotional richness that you wouldn't have expected from dermatology maybe?
Yeah, absolutely. I remember one specific patient. I was working with Alexis, one of our PAs here, and she came in very understandably frustrated because she had sought care at previous practices and unfortunately just wasn't getting the results that she had hoped for. And so I explained the situation to Alexis, and we were able to go in there and make the patient feel confident when they were walking out with this new plan. And we did follow up with her, and she was happy. She was very improved. And being able to see her at the initial visit and the follow-up and seeing the progress that was made just kind of solidified my passion for medicine and seeing that what these providers do in the office really do make a difference in the day-to-day life of these patients. Yeah.
So we've talked a lot about how you support the medical side of the practice, but obviously at Charlotte Skin and Laser, a huge part of what we do falls more under cosmetic dermatology. A lot of times our MAs, when you come in, you first learn the medical side, and then as you get more comfortable, we'll kind of pull you in on cosmetics. And I think for Samantha, your first day supporting Dr. Roston and cosmetic derm was yesterday. So how did that go?
Let me tell you, it was amazing. I had so much more fun than I anticipated.
Okay, good.
And it was a big learning curve, I'll be honest, but it was something that I really, really enjoyed.
Great.
I did get to work with Dr. Roston and just see the way that she practices, which is so much more different than med derm, but in a really great way.
Yeah.
And seeing not only the differences in interacting with the patients, but in the tools that you need, what kind of procedures are done, and how cosmetic procedures and medical dermatology just differs.
Yeah, absolutely. And I think I overheard throughout the day, Robin, our wonderful longstanding RN, I overheard her walking you through it, reassuring you, kind of helping guide you about different things. So there is a lot that we throw you right in, but we do try to support in different ways. And I think a lot of your training on both sides is really from your peers. Would y'all agree with that?
100%.
Yeah. So Samantha, I think even Mansi, she trained you in some things. And I remember Mansi, I can't remember exactly what it was, but Mansi was like, man, I can't believe I've been here long enough to actually train somebody.
I know, it was a monumental moment for me. I was like, wait, she's asking me for help. Like, I can actually do this.
Yeah.
Samantha was like, I remember the first time, I think it was me, that I was the first person you were shadowing.
Yeah.
And she comes in, she goes, how long have you been here? And I'm like, I've only been here for like 4 months.
Yeah.
And she was like, wait, you seem like you know what you're doing. And I'm like, well, I feel like I've learned so much here in the span of 4 months. You just learn so quickly. And so it was awesome training her. She was a fast learner. So
yeah. And honestly, all the MAs here are so confident in their work. And you pick up on that when you're coming in. And it's just a really great work environment. All the girls are confident. You feel very supported. And it's a very safe place to ask a lot of questions.
Yeah.
Well, I hope it is. I think that's my goal, certainly, is that I want you guys to come into a positive work environment where you feel comfortable, where you can relax and really do your best work. So I'm glad that that's how you feel, because that's what we want. So one of the things we had just on our outline, if anybody's out there thinking about applying, it says, what qualities make a medical assistant stand out? What are we looking for when hiring? So if you can't tell from our rockstar MAs here, one of the things that we are really looking for is not necessarily a lot of healthcare experience, though certainly that helps. The things that I look for the most are ambition, ability to work well in a team, ability to learn quickly, and I like problem solving. So Michelle, who is one of our rock star MAs who's been here at least 3 years now. She's fabulous. She actually trained me on our EMR when I first got here. But the other day I needed to order a test that I had never ordered before. And without asking, I heard her on the phone with the test center trying to figure out exactly how we were going to order that test. And so that kind of initiative is really hard to teach. And so that's what we try to identify when we're looking at candidates. So it's not necessarily, your past work experience, but kind of your character traits that would make you succeed in this kind of environment. Mm-hmm. All right. So we're going to wrap up here soon, but just I'd love to know if this experience has changed your future plans at all. Has it changed about how you would think about your future career or just further solidified?
For me, I would say that it's just further solidified my love of medicine and seeing all the great work that these providers do and seeing the positive impact on these patients' lives. Being able to assist hands-on, being in a fast-paced learning environment, and just seeing the positive impact for me has really solidified that I want to go to PA school and has made me that much more confident in this process.
Yeah, I 100% agree. I think also just work environment, just being in an environment that's always positive, always willing to learn, just having the ability to adapt in different ways is something that I'm going to look for whenever I'm out of PA school. Mm-hmm. So I think something like that is super important for other MAs who want to come and join the clinic should look for.
Great. So would you say that it's lit?
Oh,
it's fire.
Lit.
It's fire.
It's fire.
Is it bars?
It's not. I don't think it's the wrong context, but it's there. The idea is there. I promise.
Yeah.
All right. So I have to say, one of my favorite parts of working with our medical assistants is that most of them are kind of in their early to mid 20s. I'm an elder millennial. They're fresh Gen Zs, and it is so much fun. I am loving Gen Z. We had another young MA who was just with us last summer who looked me in the eye one day and she was like, Dr. McLean, you're allowed to say no sometimes. And it really just was such a simple, mind-blowing moment. And I think, did one of you tell me that recently? I don't know. Anyway, I don't know who it was, but I keep getting reminded that it's okay for me to have boundaries sometimes. And I think Gen Z is hardworking, smart, creative, collaborative. I'm so impressed, and I learn from y'all every day, not just the lingo, but also I'm just so impressed with your vibes. Is that how you would say it?
Yeah, you killed that one.
Yeah, cool. All right. Well, thank you so much for everything that you do. For our patients, for our provider team, for me. It just is truly a pleasure to work with y'all. And thank you for joining me on the podcast. This was fun.
For having
Thank
us.
you. We ate no crumbs.
You ate no crumbs. Thanks for listening to Queen City Skin with Dr. Elizabeth Roston and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.